Hi, welcome to the North Los Angeles County Regional Center's Purchase of Service Expenditure Data public meeting. I'm Ruth Jenga, the Regional Center's Executive Director. North LA's mission is to create a community including families where each individual with a developmental disability has the opportunity to live a healthy, productive, and inclusive life. Know that our strategic plan is calibrated to support our mission, as are all of the services and supports that we provide. We're committed to serving the needs of all of those in our community across our diverse communities, regardless of age, race, ethnicity, diagnosis, or where people live. North LA is one of 21 regional centers in California. We are the largest of the 7 regional centers in LA County and the 3rd largest in the state. We served a total of 31,619 individuals as of June 30th of 2022. That includes individuals who were in our intake department. That's applying for regional center services. Also individuals who are residing in developmental centers for treatment, or individuals that we share with other regional centers. We serve individuals and their families in the San Fernando Valley, Santa Clarita Valley, and Antelope Valley. We have a multicultural and multilingual community. Each year, we share our purchase of service expenditure data, which is information that explains how much the regional center spends on services for those we serve. Today, we're sharing data from fiscal year 21-22, which is July 1st, 2021 through June 30th of 2022. This information is also available on our website and has been posted since December of last year. So the goal for today's meeting is to share information about the amount of funding we spend to purchase services for those we serve and the differences between the groups of individuals that we serve when it comes to both authorizing regional center services and individuals using regional center services. We will also share information about the center's efforts to increase people's ability to obtain and use our services, and collect your opinions on why some groups may not be using services, and also your recommendations about how to help people obtain and use regional center services.
Good afternoon, everyone. I'm Evelyn Mycomi. I'm the Chief of Consumer and Community Services here at North LA. I will continue with the presentation. Disparities in NLACRC expenditure. We see some differences in NLACRC expenditure, sometimes because of the following reasons: where services are located, where the consumer lives, whether or not generic resources, services, and supports are available, and/or based on the complexity of the disability. Disparity is defined as a type of difference. Purchase of service, POS disparity. People or communities can experience disparities, also known as differences, based on the following: unique ability needs, either cognitive, sensory, or physical, racial or ethnic group, religion, socioeconomic status, gender, age, mental health, sexual orientation or gender identity, geographic location, lack of resource or barriers to access resources. Data shows that lack of services and access equity affects expenditures by ethnicity in our community. Disparities can be linked to individuals and communities that are underrepresented and underserved. Age of NLACRC consumers. For the purpose of the data from the Department of Developmental Services, DDS, in this presentation, the term consumer means both consumer and applicant who received purchase of service. This includes assessments funded by NLACRC to assess regional center eligibility. The following slide represents the age of the consumers within our catchment area, totaling 34,418 individuals based on DDS data. It is important to note that DDS indicated that the numbers of consumers shown here as of 34,418 includes anyone that received purchase of service, POS, during any time during the entire fiscal year of July 1st, 2021 through June 30th, 2022. Whereas NLACRC's consumers totals previously reviewed reflects 31,619 consumers, total number as a point of time as of June 30th, 2022. Individuals who may have moved, are deceased now, and those who received an assessment for eligibility but were not found eligible may have been included in the DDS counts. The percentage breakdown of total persons served by age based on the DDS data shows 50% are ages 3 to 21, 30% are ages 22 and over, 20% are ages 0 to 2. The breakdown of total individuals in NLACRC's catchment area based by language. Total persons served, once again, is the number from DDS at the point in time of 34,418. You will see the breakdown of 76% are English, 22% are Spanish, and 2% are all other. In addition to the percentages described here, I'd like to define that under other languages, North LA has Armenian, Farsi, Tagalog, Russian, Vietnamese, Korean, Arabic, and American Sign Language known as ASL, tallying up the total 10 other languages served within our catchment area. Race or ethnicity of NLACRC's population versus LA County population. The information presented on this chart is based on catchment areas from 2020 census, which included Health District 5, Antelope Valley, Health District 19, East Valley, Health District 62, San Fernando Valley, and Health District 86, West Valley Health District. NLACRC wants the public to be fully informed about the data that's presented. There are some differences between the data we are presenting today and NLACRC's current census and actual services purchased and used by consumers. On race and ethnicity data, NLACRC combines race and ethnicity data, but the U.S. Census Bureau separates these categories. The other category includes who identify as multicultural and other race ethnicities. For additional information, please reference the appendix. As you will notice on this slide, it's quite comparable, our catchment area percentage of those who we represent, similarly to those on the census for the Hispanic and Latino community. Based on the census of 2020, the white population census information and that of North LA's shows slightly different. It demonstrates that according to the 2020 census within our catchment area, there is a larger amount of white individuals residing in our catchment area, and the amount of white individuals we serve is slightly lower. The African American and other demonstrate a higher percentage of individuals we served in comparison to the census of 2020 for those who reside within our community. And that of Asian is similar to that of white. There are a larger number of individuals in our catchment area based on the 2020 census versus that Asian population that we are serving. Per person expenses by ethnicity and race. This slide demonstrates all ages combined, and it is a 4-year snapshot from fiscal year 2018 through 2022. The data presented here is DDS data. So you will see that in other or race, multicultural, categorized ethnicity, there was an 11.69% increase from 2018 to closing of fiscal year 21-22. In the Hispanic and Latino category, there was a 43.19% increase in expenses. In the Asian community, there was an increase of 28.30% increase from 2018. African American Black, there was a 55.47% increase from 2018 to 2022. And for the white population, there was a 32.31% increase from 2018 to closing fiscal year 2022. Total annual expenditure service by ethnicity and race, all ages, from fiscal year 1920 compared to fiscal year 2021. As you can see here in the side-by-side comparison, there was an increase in expenses from fiscal year 1920 to fiscal year 2021 in the following categories: Hispanic or Latino, African American or Black, other ethnicities or race, multicultural. Total annual expenditure service by ethnicity and race, all ages, for fiscal year 2020, 2021 to fiscal year 21, 22. And you will notice there was an increase in expenditure in the following categories based on all ages: Hispanic or Latino, Asian, African American or Black, and other ethnicities or race, multicultural. Total annual expenditure services by ethnicity, race, all ages from fiscal year 1920 compared to fiscal year 21-22. In this slide, there is an increase in population served and an increase in the expenditures provided. Detailed tables on total annual expenditures are in the appendix detailing these expenditures by ethnicity and race. For whites, there was an increase of 12.98% increase in expenditures, while the population grew 6.46% in our catchment area during that 2-year period. There was a 30.47% increase in total expenditures for African American Black, while the consumers served in our catchment area increased by 9.52%. For Asian, there was an increase in 24.63% in total expenditures. The population in our catchment area for that same time period increased 12.15%. Hispanic or Latino increased 32.3% in total expenditures, while the population we served increased to 7.71%. For other ethnicities and race, in the 2-year comparison, there was a total of 33% increase in expenditures, while the population grew 27.22%. Per person expenses by ethnicity, race, ages 0 to 2. 4-year comparison from 2018 to 2022. This slide demonstrates a decrease in ethnicity or race, multicultural, by 7.56%. For African American and Black, it shows an increase of 4.9%. For Hispanic and Latino, it demonstrates a 1.84% increase. And for Asian, 8.51% decrease. For white, 3.94% decrease since 2018. The difference between Early Start and other per person expenditures age group is that Early Start will fund for developmental evaluations for every child that comes to our system for the intake process. Doesn't necessarily mean they will be individuals who will continue to receive services from North LA if not found eligible. Once the needs are identified, generic resources or insurance needs are to be assessed as well. Per person expenses by ethnicity or race, ages 3 to 21. This slide is a 4-year comparison and it demonstrates under other ethnicity or race, multicultural, 42.81% increase. For Hispanic or Latino, 62.70% increase. Asian, 38.81% increase. African American Black, 78.17% increase. And white, 47.47% increase since 2018. It's important to keep in mind that for the age groups, there are needs that may be met in combination with resources from school districts or other generic resources. In addition, for African American and Black, and those identified as Hispanic or Latino, there is an increase in expenditure higher than 50%. Per person expense by ethnicity, race, ages 22 and over. This data is also representative of a 4-year comparison from 2018 to 2022. For those ages 22 and over, it shows an increase of 26.89%. Other ethnicity or race multicultural, there was an increase of 26.89%. For Hispanic or Latino, there was an increase of 32.88%. For African American Black, there was an increase of 46.3%. For Asian, there was an increase of 27.62%. For white, there was an increase of 31.14%. There's been an increase in expenditure for all ethnicities within this age group. This age group expense vary based on the supports they need and whether they live independently, with family, or in a residential setting. Per person expenses by diagnosis. This data does a 4-year comparison, but it breaks down the data by diagnoses versus ethnicity or race. Detailed table on the per person expenses by diagnosis are on the appendix detailing these expenditures. NLACRC believed it was important to break down this data by diagnoses because the type and severity of the diagnosis has an impact on the expenditures per individual. Cerebral palsy, there was an increase of 32.97%. For intellectual disability, 39.07% increase. For epilepsy, 32.45% increase. For category 5, 39.89% increase. Category 5 are individuals with disability conditions found to be closely related to intellectual disability or who require treatment similar for individuals with an intellectual disability. For autism, there was an increase of 41.75%. Those categorized as no diagnosis is 0.9% decrease since 2018. For the no diagnoses category, these are early start or provisional consumers. Those would be children primarily in early start and would likely also include children in provisional program or intake who do not have a developmental disability diagnosis. Note, the provisional program came about July 1st, 2021. So the no diagnoses and provisional data is still very new. Living arrangements by ethnicity as of June 30th, 2022. This slide demonstrates each of the categories based on living arrangements by ethnicity. As you can see, based on the data, we have 95.5% of those who identify as Hispanic living at home, 78.24% of white live at home, other ethnicity, race, multicultural, 96.8% live at home, African American, Black, 84.25% live at home, and Asian, 92.7% live at home. The following slide demonstrates per person expenses for consumers who live with parents as of June 30th, 2022 by diagnosis. You're able to see in this slide the dollar amount difference between those ages 22 and over and those ages 3 to 21. The following slide is per person expense for consumer living independently as of June 30th, 2022. The green bar represents ages 22 and over. The orange bar represents 3 to 21. Category 5 and epilepsy, living independently for 3 to 21 is 0. The data demonstrates that individuals under cerebral palsy, intellectual disability, and autism that may be ages 18 to 21 who live independently have expenses in this category. Per person expense for consumer living in community care facilities as of June 30th, 2022. This data demonstrates the expenditure per individual based on diagnoses and age group. It is categorized 22 and over and those 21 and under. Per person expenses for consumers living in group homes as of June 30th, 2022. The data demonstrated here is per capita for those individuals divided by age group, ages 3 to 21 and 22 and over who live in a group home. Per person expenses by ethnicity, race, and diagnosis, fiscal year 21-22, based on regional centered data. In the previous slides, we were reviewing DDS data. This specific data was pulled by North LA to demonstrate regional center per capita data for fiscal year 21-22 by ethnicity and per diagnoses. The following slide demonstrates consumers with no purchase of service based by ethnicity or race for fiscal year 21-22. The categories are broken down by ethnicity, and for each ethnicity, you will see the total number of individuals. You will see the total eligible consumers in our catchment area, total number of consumers receiving POS, purchase of service, total number of those not receiving purchase of service, and the percentage comparison. There is a total of 16,213 Hispanic eligible consumers, and out of that number, 4,262 do not have purchase of service. The second largest population within our catchment area, white, there is 9,424 eligible consumers, and out of the total number of consumers, 2,054 are not receiving purchase of service. There is a grand total of 34,418 consumers, eligible for North LA County Regional Center services. There is a total of 8,400 with no purchase of service. The data demonstrates 24.4% of total individuals served have no purchase of service. Some of the strategies that North LA is using to improve purchase of service includes, but is not limited to, the following. Enhanced caseload units have been created. There is an SDP orientation and sessions held regularly for those interested in the self-determination program. There are town hall presentations for consumers and families to learn about services and supports. Grassroots roundtables to build relationships with community-based organizations, also known as CBOs. Publishing a revised consumer and family guide and improved technology and tracking of SANDIS data on consumers with no purchase of service. Participants in the self-determination program by ethnicity. The self-determination program provides eligible participants with the opportunity to develop and implement person-centered plans based on an individualized budget that the participant controls within program guidelines. This data is effective as of December 31st, 2022. Currently, as of March 2023, North LA has 186 participants in the self-determination program, also known as SDP. Race and ethnicity of NLACRC staff. We understand a need for a diverse staff of CSCs to accommodate the diverse community we serve by employee staff with cultural competencies and language abilities. This slide demonstrates the total percentage for fiscal year 2020-2021 and fiscal year 21-22 per ethnicity. As of December 31st, 2022, NLACRC had 238 bilingual staff. Out of the 238 bilingual staff, 190 were CSCs, service coordinators. Other staff languages North LA has include Korean, Farsi, Armenian, and Tagalog. What are we hearing from our community? Feedback that we've received from our community includes the following. Some people are not able to reach their service coordinators. Some people do not know what services are available. Some people do not know how to ask for services. And the regional center sometimes does not give enough information about available services. The way we are responding. All of the efforts and strategies NLACRC is taking to reduce disparities and increase access to regional center services. We will now take some time to review how we are responding to our community's feedback. We are going to go over some of the efforts and strategies NLACRC is taking to reduce disparities and increase access to regional center services. In an effort to reduce disparities, we have an on-duty Officer of the Day Specialist Call Center. In addition, NLACRC posted the Contacting Your Program Planning Team guide on our website and contracted with Ring Central to improve messaging, including text for contacting CSCs. We have a Parent Mentor project to address barriers, engage in community outreach, and we have implemented the Parent and Family Support Specialist Hotline to increase access to regional center services. We've ensured to post on our website in both English and Spanish case management contact procedures for anyone needing assistance. We are focused on CSC recruitment and caseload reduction. Our recruitment focuses on a diverse platform to seek and increase bilingual service coordinators, and in addition, legislative advocacy and training. NLACRC consumers, family members, board members, staff, service providers, and others within the community learn advocacy skills through our activities, including our grassroots legislative events with ARCA annually and our NLACRC spring-summer events such as transition fairs, SDP fairs, resource fairs. NLACRC is making an effort to ensure information about regional center services is available and accessible. Grassroots marketing and outreach initiatives provides regional center material to local community organizations and builds relationships between NLACRC and the community. NLACRC's diversity, equity, and inclusion supervisor and other staff conduct meet and greets virtually and in person to build these relationships. Like translating IPPs, letters, and publications, interpretation services provided at meetings, IPPs, and public, if requested and needed. Through our NLACRC efforts to improve our website and social media access, NLACRC provides our website with a language translation button to reach diverse communities, as well as an accessibility tool, Accessibility widget, with capabilities for web content accessibility guidelines and Americans with Disabilities Act compliance. NLACRC provides social media accounts that provide information in both English and Spanish. NLACRC also records our community trainings and makes them available on YouTube for reviewing with links on our website. NLACRC's Consumer and Family Service Guide provides a useful and convenient guide that lists services and resources offered by regional centers and other agencies available in both English and Spanish. It is also available online in both English and Spanish in PDF format. Common Services Brochure and Service Description. NLACRC provides a useful brochure that lists the most commonly used services for consumers. There are separate brochures for each age group, and brochures are available printed or online in both English and Spanish. NLACRC's Disparity Committee. The Disparity Committee was created to help address the inequities that exist and directly impact the community with disabilities. NLACRC's efforts also include consumer and family support groups, such as Cafecito Entre Nos, Aprendiendo Entre Nos, Alianza de Hombres, African American Support Group, Parent of Adult Children Group. These workshops provide families with time and opportunity to learn and engage in a safe space to voice their questions and concerns. Participating in informal exchanges with families, professionals, and regional center staff. The participants have an opportunity to choose the topics discussed related to regional center support and services. Families learn skills and concepts to better support their family member with special needs. Town hall meetings. NLACRC conducts online webinars throughout the year with education on important topics to increase service access and equity in both English and Spanish. Recordings are available via YouTube, and the presentations are available in both English and Spanish. Community events. NLACRC events provide education, information, or resources and includes Festival Educacional, Transition Fair, Life After High School Fair, and Self-Determination Program Resource Fair. New Parent Orientations provides information about program planning and services available to consumers at every age. Service coordination that acknowledges cultural preference and individual choice. NLACRC makes an effort to provide service coordination that acknowledges cultural preferences and individual choice. Diversity, equity, inclusion initiatives. NLACRC has quarterly trainings for all NLACRC staff and offered to NLACRC service providers. This initiative is intended to help ensure that the delivery of services and supports is culturally inclusive for all consumers, includes a dedicated supervisor to provide support, and quarterly trainings for all staff. Person-centered planning staff trainings. NLACRC staff will be certified to train service coordinators, supervisors, and managers in person-centered training. Person-centered planning focus on empowering the people to have positive control in their lives. All new NLACRC staff receive training on person-centered planning via Zoom. NLACRC staff received 8-hour culturally proficiency training. These trainings were held in August and December of 2022. NLACRC will also receive additional diversity and equity and inclusion trainings throughout 2023 on a quarterly basis. NLACRC has a community-based organization disparity project. This initiative is intended to help ensure the delivery of services and supports is culturally inclusive for all consumers includes a dedicated supervisor to provide support. The self-determination program allocation funds were used to help support implementation efforts. And additional programs such as participant-directed services, parent conversion services, and financial management services provide flexibility and accessibility to meet the needs for disparities. NLACRC's 2022-2027 strategic plan provides a roadmap to help guide the organization and our activities. The plan has been shaped from the input of people served and their families, the Board of Trustees, the Regional Center staff, service providers, our community partners, and advocacy groups. The strategic plan was adopted by the Board of Trustees in June of 2022. NLACRC continues to build relationships in the community as part of its diversity, equity, and inclusion initiatives. The following agencies are members of NLACRC's Internal Disparity Committee: PathPoint, Family Focus Resource Center, USC in collaboration with Children's Hospital LA, Integrated Community Collaborative, State Council on Developmental Disabilities, Mixteco Indígena Community Organizing Project, and UCLA's Tarjan Center. NLACRC also collaborates with community-based organizations via roundtable conversations to explore topics and receive recommendations with the goal to build community and strengthening collaboration. The following were DDS Service Access and Equity Grant awardees for fiscal year 2022-2023. Wayfinder Family Services for Early Intervention Family Navigator. UCEDD at Children's Hospital LA for technical assistance and peer mentorship infrastructure for parents. Tierra del Sol Communications Access for deaf artists with lifelong developmental disabilities. The Empower Them Collective, Ubuntu I Am Because You Are. Special Needs Network's Behavioral Tech Apprenticeship Program. Self-Determination Futures for cultural and linguistic training on LGBTQIA. Quality Care ILS for community workforce. Ohana Centers AV, Trust, Equity, Access, and Healing. New Horizons for Employment. Xander Consulting, Employment for All. Integrated Community Collaborative, ICC Proyecto Líder. Community Health Council, Inc., Learning for Equity, Developmentally Determined Workforce. Children's Hospital LA, Parent Navigators in Pediatric Clinics. Being Built Together, Community Connector Service for Korean-speaking families. 360 Behavioral Health, Early Start Reaching Diverse and Marginalized Early Start Communities. Services and supports are intended to provide the individuals we serve the same opportunity as anyone else in the community, but some may need more than others. Similarly to how this illustration of equity and equality shows. We hope everyone takes a moment to ask the question, what are the differences that are to be taken into consideration when addressing disparities? Thank you very much. This concludes the presentation portion of this meeting.